evening and welcome to Sisters Weekend Show. My name is Lady N Mahlako Mokgwe and I'm your host. I've got my beautiful co-hosts in studio. You're looking nice and bright, girl.
Thank you so much. Thank you.
How are you?
I'm good and yourself.
Over to you.
Oh yeah, welcome to Sisters Weekend. My name is Bongi Gladness as usual. Yeah, we here.
Sibuyile.
We back.
Unfortunately, Keke couldn't join us today in studio. She's very sick and we are wishing her a speedy recovery. But anyway, we've got a gorgeous lady who's joining us in studio all the way from Limpopo. Can you believe it, guys?
Wow.
How are you, Helen?
I'm good in yourself.
Thank you so much for making it, in such short notice.
Yeah.
But thank you so much for saying, I'm there, no maganjani.
And welcome.
Vacation.
Welcome.
Thank you so much.
Yes, and we thank you.
Please introduce yourself to our viewers.
Oh, my name is Helen Lekgothoane. I'm from Lekgothoane, Limpopo, a deep rural village called Lekgothoane. That is where I come from. I'm the 10th child at home. Yeah.
Yo, 10.
10.
Baphila kamuka.
Kamuka saphila.
Bathong wena. You guys are so blessed. And when number mang?
10.
What we 10? Oh, you're the 10th. Oh.
The 10th.
Yo, Helen, so last born. I was spoiled, mara. What's about the last born is right?
Nix, born.
Yo, Helen, thank you so much, like I said, for joining us, to release the last minute, but you're able to say, you know what, ladies, for anything that has to do with Sisters Weekend, I'm going to be here. So today we are discussing a very important topic, especially for us women, women's health.
Oh, yes.
What can we say about women's health?
Well, women's health is so broad, hey?
Yeah.
When we're talking women's health, like as ladies, we have the outer being and the inner being.
Yes.
So the inner being is the one that is more important for us to take care of and to know what is it that we need to do as ladies to take care of ourselves.
Yeah.
Firstly, I can start by pap smear. Yes. A lot of ladies, they are scared of doing pap smear. They will tell you, if I go and do pap smear and that thing that you're putting inside, what if it makes me a little bit bigger and all that?
So women say that?
Yeah. They say that they are scared.
Okay.
Like they are very scared. So those are the myths, but it's very important for every lady, especially when you are sexually active. You need to do pap smear.
Okay.
Because that's where we get the cancer cells and they can be able to be treated or to be banned at early stages. So if we wait for those cells to grow and multiply themselves, and then at the end of the day, now you are having cancer of the uterus, you are having, they say, cancer of the womb. Let me simplify it,
yes.
because with the uterus, people will be like, what is the
Already
uterus?
so deep and you need to bring it back to
a midwife talking now.
Yeah.
So yeah, we need to do pap smear at least 3 years. In every 3 years.
Every day, okay.
Just try every 3 years, but it can still be valid for 5 years.
Okay.
So you can do it after every 5 years. But if you have done it and they tell you, do not say at the clinic they said, no, I don't have, it's fine. There's nothing like it's fine. It's either there will be stage 1, stage 2, stage 3 of cancer cells in your cervix or in your womb, where they are getting that mucus from the orifice of the uterus. So we need to do pap smear, ladies.
So pap smear, pap smear, what are we checking? Because we mentioned pap smear, mara batho ba bangata ba tsebe gore ha ke ya ko clinic ke letsa pap smear, what am I exactly going there for?
Rona na le problem ya gore a ntse re gola re ba le problem ya cancer ya popelo.
Oh, okay.
So pap smear e gona ke mo le gore re checka gore na ke na le cancer ya popelo na or ha ke na yona. Those cells are there. Remember, as you meet with a male figure, you are getting what we call cells of Langerhans.
Okay.
On their thing, So that cells of Langerhans, they carry small cancer cells. So those cancer cells, they are deposited into your vulval orifice.
I guess who want to.
Okay, let me simplify.
Layman's term. Oh, now it makes sense.
Yeah. So had those cancer cells, that is when they start to spread. They metasize, like they multiply. How does no multiply? Modifican di dula. Mo popelong ya gago inside now. We are talking inside the womb. So how do you feel mo popelong ya gago di dula mole? That's where now they start to develop a growth. Then you get your fibroids, fibroids, and then After the fibroids, now you have cancer of the uterus.
Oh.
Okay. So the fibroids are caused by that, as you say.
Yeah,
Okay.
some are caused by that. Some other people o fumane le gore motho a hola ne o godile a inherited this thing from family line,
yes,
because
yes.
it can be inherited.
Yeah.
And remember, it comes to the 4th generation, not every generation. So when you trace, you need to trace back to the 4th generation. Yeah.
And you mentioned about the fibroids, when I Helen, and I there's a other thing maybe besides the cyst. What is the difference between cyst and fibroids?
Well, fibroids, they are just, sometimes they are on your mo popelong ya gago.
Okay, yes. I think it's a bit better because the other way that you use it, it's just
di mo popelong.
Yeah,
O
yeah.
kere hore ha o le mosadi o nyaka go ba pregnant. Di blockile that egg. You understand? So how can you be pregnant and then because on a little fibroids, so they've blocked those eggs for horing the sperm fertilize the egg.
The egg,
so
okay.
that root sperm fertilize the egg is
Equalegile. Okay.
The fibroids
Yeah.
So they are roundish things
around the population side.
So a cyst, it's more of an infection.
Oh, okay.
Cyst is more of an infection. Fibroids is more of the cells of cancer.
Okay.
You
And if a
understand?
person has those, why do must I go under Caesar
you
or
go
can I
under
drink
a certain,
something?
procedure whereby they will say, let's say, but okay, there are a scope whereby when we're taking a scope, there's a light, but and then they insert in that wire which has a light. Then they're able to see on a screen, everything. Okay, what is it that we need to cut, where, and how?
Just to check into it. And why is it so important when I Helen as Baba side about such things, because a lot of people, they're not informed. Like right now, I didn't know the difference between cyst and fibroids. Right now, I didn't know that a cyst is it's a kind of it's just an infection. You understand? So why is it important, especially when because this is your profession as a nurse? Why is it important that Baba side they need to know about their health?
It's very important because let's say now you get married, you want to have kids, how be pregnant?
And which or why?
What could be the cause of me not having babies? Those are certain things that leads to that. Or you get pregnant and then in your progress of pregnancy, maybe let's say in your first trimester, they tell you that you have fibroids. And those things are very painful. And there's no medication that can heal that pain.
Sure.
You understand? So they will tell you, you just need to bear the pain until delivered, or else tell us if you want us to terminate.
And again, I always hear that when you have fibroids, you have to have more kids. Like, is it true that you have to have more kids for it to tone down?
I think when let's let Helen respond to that question when you come back. Babugele Makaya, we are still here teaching you about women's health. Please stay tuned to Sisters Weekend. Ungahambi ungayindawo siyabuya in a short while. Welcome back, Babugele Makaya. You're still tuned into Sisters Weekend, and I'm your host, Lady and Mahlako Mokhue. Bongi, when we went to the ad break, you were asking Helen a question about fibroids.
Yeah, fibroids. No, you know what I wanted to know, Helen? I wanted to know, like, I hear people mostly saying when you or if you have fibroids, you have to always have kids for them to
go away.
To go away or tone down, something like that.
Sure. Okay.
How true is that?
Yeah, no, that's
people
a myth.
talk. Hey,
yeah, I know
we
have strict doctors, we have strict nurses.
Like that.
So that's a myth. I know of a lady. She's pregnant with her 7th pregnancy.
Okay.
She has only 2 babies alive. Then she had miscarriages. You understand?
Yeah.
Only now with her 7th pregnancy, then they realize that she has fibroids. And she's crying of pain day and night.
Sure.
Sometimes she'll go like, oh, at least today I'm better because I find a better position for me to lie on when I'm sleeping. You understand? And there's no medication that can heal that. The doctors will just tell her that, you know what, you just need to bear the pain until you deliver.
Sure.
Throughout pregnancy. Imagine 9 months, every day you are having this.
So she's always in hospital. Like, she has to always be in hospital.
You can be home, but the minute she goes home, she just feels like, oh my God, maybe it's much better when I'm in hospital. You understand?
Sure.
So she needs bed rest. So she's suffering. It's torture, those things. So hence we need to make sure that we check and get to get these things on early stages and see how to
We can treat them.
Yeah.
But Helen, okay, for somebody who doesn't do pap smear, right? How do you get to know I've got fibroids? Because right now, let's say I don't have pains, like I don't get any pains. How can a person, without going for screening,
yeah.
how do they find out if they've got?
Well, the other thing, someone will tell you that every time I'm meeting with my partner, intimate way, I'm having this pain that I can't bear. And sometimes now the husband or the partner will start to get worried to say, what is it that I'm doing wrong?
Oh, yeah.
You understand? Yeah.
Yeah.
And now he start to have that phobia to say, ooh, I can't relax with my partner because she's experiencing this pain. We don't know what is the cause of pain. You understand? And to those who don't know these things, they end up saying to their partner, hey, you are sleeping around.
Huh?
You are sleeping around, you are bringing me all these sicknesses. There's something deep. You need to get to the root of this thing. What is causing this thing?
Yes.
Yeah.
And talking about that pain, Helen, when I spoke to one of the ladies, because normally we share the topic before we discuss it here to say what is it that they want us to ask the nurse. So somebody was saying, Matlako, I've got a problem that every time when I sleep with my partner, right, I start developing this smelly discharge. What causes that? Because Leona is in the air.
It's infection. Remember, us women, it is what we call vaginal yeast. Vaginal yeast is either you can get it from the seat of a toilet, in public toilets.
Is it?
Hence, it is very important to have wipes. Always wipe. Whether they are drops, whether it's clean, you need to wipe because bacteria, you can't see them with your naked eye. Yeah, so it is very important to always wipe because we get that yeast. And then after we got that yeast, you tell yourself, all right, I have a liner on, a panty liner on. Then you are putting on your panty liner. Until you are even protecting that bacteria to be even warm on that liner. And then it penetrates inside. Yeah,
sure.
Then it penetrates inside your vagina, isn't it? And then when it gets there now, you develop that vaginal yeast. You'll have that smelly discharge, or sometimes it's a bit itchy. Or sometimes you feel like it's like I have that rush. And then you shout at your partner. No, ladies, let's just be extra careful.
But then how do you then treat that? How do you, when you start having those symptoms or start feeling...
Antibiotic is the only thing that is going to clear everything up. One lady once called me and said, I have this thing and my friends made me buy this cream and now it's getting worse. So avoid just inserting anything in your vagina. That is a very sensitive area. So you can't just put anything in there unless it is prescribed. Because there are those prescribed creams that you can insert. But also you don't use your finger. There's a certain tube that, you will squeeze that thing in that tube and it will take it direct to where it needs
to be. Yeah. And Helen, I mean, you mentioned that you're a midwife, right?
Yes.
So is this, it's something, how do you guys, I'm sure it's such a beautiful thing just to watch, a baby coming out. No, man, I'm scared.
I always ask her. I once asked her about that. How do you feel?
When I was studying my 4-year course, and then when I got to 3rd year where I was studying midwifery, now we started to do the cases like the deliveries. We had to observe 5 cases only, and then you start making deliveries. I remember the first time I observed, I was like, oh my God. So that thing, like we were reading it, that there's a 360-degree turn
of a baby.
And I was asking myself, 360 degrees, this is madness. How is it happening? And then now seeing it happen, I went like, oh God. This is miraculous.
And
it is so amazing.
Because you're a woman, Helen, I can imagine this. I'm sorry to say this on TV, but just imagine seeing the vagina stretch, the power of a vagina, guys. Seeing a vagina stretch and coming back. How does that happen? Can you just take us through that?
Okay, remember.
I know that we're going to traumatize our brothers out there.
We have the pelvic bone.
Yes.
Right? On the pelvic bone, when we do assessment, we're going to be able to detect or tell you that you can do normal delivery or not.
Oh, yes.
Because
not everybody who can.
Yeah, it's not everybody who can deliver normally. Because we call them the ischial spines.
Okay.
They are just like this.
Okay.
Again, this is your pelvic bone, and we have these things, we call them the ischial spines. So the ischial spines need to pave a way for the baby to be able to come out. Yeah. Because the baby cannot come through those bones. So they need to...
Yeah, warm side.
And after stretching, then that's where now the vaginal orifice, remember that thing, it's just flesh, the libias, minora and the majora, automatically they will just pave a way for the baby. But then if in a way naturally, but if the orifice is too small, we cut what we call episiotomy.
So what today?
Episiotomy, I take my sterile Caesar, and while the woman is having pain, that's where I do what? I cut. And you don't just cut anyway. There's a specific angle where
you need to,
cut off,
because
so that you don't cut through the anus.
Oh, yeah.
So it must be a place whereby you know that I'll be able to what? To suture it back to its normality.
But have you ever had cases where a doctor or a nurse cut the wrong way? Like we said, through...
Not cutting the wrong way, but cutting...
Oh, not the wrong way, yeah.
Overdose.
Yeah, overdose. Yes.
Other people, they cut extremely so. And then you find that now you need to repair the anal area because now it has affected the anal area. So it's important for you to know your story as a midwife. Because most of the time we are the one doing the deliveries. Your guy is like...
Guys, Helen, I don't wish to be in your profession. But you're still tuned into Sisters Weekend, and we're discussing a very, very interesting topic. Please stay tuned. We are going to take a quick ad break, and we'll be back shortly. Welcome back, Babugele Makaya. You're still tuned into Sisters Weekend, and I'm your host, Lady Anne Matlaku. We still have the gorgeous Helen in studio. Also, Helen, nerebuwa ka taba ya vagina before when and pregnancy.
Yes.
So, a question just popped right now. Hore, this thing I was steam my vagina, bari ito tusa hore ebuele. Can it?
Well, some people, they say, I steamed and my man went like a man.
Hey,
there was something different.
Yes.
I think, yeah, I would say to some it works.
Okay.
Because that steaming, I would say it helps to contract those, the veins or the muscles of the vagina, right?
Okay.
So that it's gonna loose.
Okay.
So I guess most of the time, if you normally, the vagina, the muscles, they lose out what we call elasticity.
Elasticity, yes.
So when they lose out that elasticity, most of the people will say there are certain exercises
Kegel,
that I'm
Kegels,
doing.
yes,
I know that
yeah.
I'm contracting
Yes.
my vagina to come back to its original state, but it will never come back to its original. But it becomes much better than and then it's just ilapile. The elasticity is not there. Even when your partner comes in, yo, matad. You understand? So yeah, people who are comfortable with steaming can continue with their steaming.
And that is why it's advisable how to give up birth. Sometimes it's modern.
Yes.
But modern, when you give birth, I want my partner to be there. You know what? Yo, he must be there to cut. I will never allow her not to my. Because when you're watching that head comes out, you're like, no,
I witnessed a white guy while I was still in Lekgothoane.
Yeah.
After the baby came out, he passed out.
I can imagine.
And then now we had to attend to this guy now.
Instead of attending to the baby.
To the mother and the baby. We are rushing, emergency. Like, hello, please, don't do that. I know we want that, we love that. But let's just stick to this thing of old age, the old way of doing things.
Man.
Maybe he can come in.
No, but then what about those that want to? I mean, there are men who just say, I want to be in.
My dear one, let me tell you, things are going to change.
Yeah.
Things are going to change. Definitely, there's that trauma.
So, tell us when I Helen, because I think but I want to know the challenges that women go through when they are pregnant. There's just so many things, guys. Yeah, there's just so many things. Now we're struggling with eating. You know, I think I used to enjoy eating the sweets more than food, and I used to like liquids. As
you say that, I remember me. I used to drink only dairy things, and it had to be like yogurt, like it had to be something drinkable. And also, I remember there was this juice that was mixed with dairy that I used to drink it. I just wanted something that has dairy in it.
What are some of the challenges?
Let me just make an example with myself. I had a condition with my first baby and the second baby as well. Severe hyperemesis gravidarum. Hyperemesis gravidarum is like a severe, like you are vomiting excessively. We know that pregnant women
Yes,
will
they
vomit.
vomit, yes.
I get-
The first 3 months
but
especially.
The first 3 months especially. But with me, it was so excessive that I lost more than 30% of my body weight.
Sure.
And you know, the street nurses, they started to diagnose. Hey,
Aibo.
Helen, tsamoja di ARV
Batho.
batho. Magama go fihletse, you understand? That is how horrible it
Yeah.
was. I lost so much. And I remember now even my guy is saying, hey, you need to terminate because we don't see life
You
here.
cannot
will
carry,
die." That is
yes.
when I named my son Klulo. I said, Yogi Klulo ya mama. He's going nowhere. You understand? So if you don't know these things, they will frustrate you. Even the husband will leave you. Aro matepe o. Untela matepe, ha o se pelo wa go ima wena.
You know the first one exactly.
So we need to know, okay, a person can vomit, a person can hypersalivate. Hypersalivation, you are spitting out saliva
Yes,
every now and then.
yes.
You can't swallow
Yeah.
it.
And what about
a person
if
can
you've
tell
never-
you, major.
But what if you've never vomited at all? Me, with my 2 kids, I didn't vomit even from the first is it a trimester?
Yes.
Yeah.
I didn't. I never.
Every individual, they experience
Different,
pregnancy
yeah, in a different
differently.
way, yeah.
There are those who enjoy pregnancy, hey?
I like
and
me.
then and then come postnatal, post delivery. Now motho wa gona o ba le di problems.
I wanted us to
Whereby
get
now
into that.
o feel gore
Wow.
you're going mad. We call that postpartum blues.
What causes that, Helen?
The cause of that could be the fact that, let's say you have this baby, you're not having the support that you need. You really need support when you have a child.
Yeah.
Be it you are coping or not. Imagine being a first-time mother. Then now we are telling you to breastfeed. You don't even know how to hold the baby. You are just like, everything is just, that baby no ba ntho ta putenyana wa tswa no ya kwa le kwa o tsoro o mo sware jwang ha o tsoro okay le tswele ke thoma kae
Ke thoma jwang,
ke tshwara eng, you
yeah,
understand?
yeah.
Other people, they go through that. Other people, they will cry a lot, and that can lead to depression. That can lead to postpartum psychosis, whereby now you just look at this baby and onyaga homkhama.
Yes. Yes, a colleague of mine once shared that with me, actually. Yeah, it happens.
When I was, yeah, that is total, like that is, now it is extreme.
Another level.
It is so extreme. I had a patient, Haneke Stadia Psych, go Aranye Hospital in Bloemfontein. She killed her baby.
Wow.
And then she was admitted in a psychiatric hospital, and after that, she always said, "Where's my baby?"
Mara, need to
Because
like
now she's back
Helen.
to her senses.
King, it's like what happens at
you
that
are just
time?
overwhelmed. Your brain is under pressure that it can't take it anymore. There's
Sure.
nothing that can put your brain into equilibrium.
Yo. Hi.
You are not seeing.
So
a
people
baby.
go through
Yeah,
that?
People go through that. Those are some of the symptoms that we see, the signs and symptoms. This is your baby, mama. And then immediately when we
guys,
realize
this is
this
hectic,
person is going through postpartum blues, that is leading to postpartum psychosis, the baby must be away from the mother until the mother recovers. They need to go through a certain medication to put their mind back into equilibrium.
Sure. But do you have any medicine that a person can take?
Yeah,
They treat them like that?
They do get treatment. The antidepressants are there. No, you don't breastfeed when you're taking antidepressants. Yeah.
Sure. Helen, this is so hectic. I can imagine. Imagine, guys, women go through a lot, eh?
We go through a lot.
We go through, and imagine having to go through that. Kamo, your partner otoretu, kamo ona family. That is why, guys, we really need to have support groups that are.
Yeah, we need. And as women, we are so cruel to the point that rasegan. Shame. Those things, they are adding
into
to
the
problem,
stress.
to the stress that you have presently. Imagine.
Yo, Helen, thank you so much, for taking time to come and join us here on Sisters Weekend. Any last closing words to our viewers?
Well, my closing words will be that women, go and do pap smear. There's
Check
nothing
yourself.
scary about it. Let's screen. Breast cancer, let's go and screen.
Yeah.
You can do breast cancer on your own. Like, okay, if I was not holding this man, I will do it. But then let's screen. Let's not be scared to go and screen. What I love about ladies, Rata Clinic, Ariye.
Aren Clinic.
Howing.
Please close the show for
No,
us.
you just heard. Howing. Clinic ikiona.
Howing.
Let's go. Pap smear.
Thank you so much, Babugile Makaya. We'll see you next week.